Herpes zoster, also known as shingles, is the topic. And what's important to understand is that you have a virus known as varicella zoster, and that virus, that I will abbreviate VZV, is the cause of chickenpox, and that's in its acute phase. Now what happens is, later on, approximately I'd say 10 to 20% of cases, the varicella zoster virus can reactivate, and when it does, it causes shingles. So very important to remember that distinction. And shingles is just another name for herpes zoster. So don't get confused with these terms, just understand what the name of the virus is and what the name of the actual disease is. So what is herpes zoster? Herpes zoster, or shingles, is essentially a rash, and the rash involves the skin over a dermatome. And if you're not sure what a dermatome is, you can look up diagrams of this on the internet. If you have somebody's back, let's say, a dermatome is an area of the skin that kind of represents a band or stripe across. So this would be one dermatome, this would be another dermatome. So the rash, if it affects a dermatome, it'll kind of look like that. It'll be a band-like rash across the body, either the back or the chest. So what are the symptoms? The symptoms are actually pretty characteristic. The pain that is associated with shingles is pretty profound. It's even described as piercing. It can be described as stabbing or even stinging. Severe pain associated with this rash. Now the appearance of the rash is also very characteristic. It's these crops of vesicles on a red base, erythematous base. And perhaps the most common thing that they mention in clinical vignettes is the fact that it's along a dermatome. Even if they don't mention the word dermatome, they will imply it by saying band-like, rash. So if you have a person and they've got a rash on their body, the rash will be involving a band. And there's very characteristic photos of this that I encourage you to look up. Most commonly on the person's back, but also it can be found on the chest or face as well. In terms of diagnosis, really just the nature of the rash. I keep drawing it, but it's really, if you see a rash that kind of appears right along the dermatome, it's very characteristic. The severe pain that's involved, and also the quality of the pain, such as piercing, stabbing, stinging, and also, of course, the location and the nature of it, the band-like distribution. So the fact that the rash is usually a crop of vesicles, so the way it looks in terms of its appearance, and the description of the pain, and then of course the location. So those are very characteristic findings, and that's all that's involved most of the time in the diagnosis. In terms of treatment, antivirals are the cornerstone of treatment, and those antivirals include acyclovir, which is very common, valcyclovir, which is a little more expensive, ganciclovir. So as you can see, they all have the same ending, and they're all antivirals. One final point I wanted to mention before I look at the clinical vignettes is there's something very important known as postherpetic neuralgia. Basically what this is that it's persistent pain that stays with the patient after shingles resolves. And the reason is because what's happened is the nerve that the virus affected has been destroyed, and that is causing this persistent pain. So that varicella zoster virus has damaged this particular nerve. And in addition to severe pain after the shingles has resolved, they also have symptoms of allodynia. Allodynia essentially means that you have pain with non-painful stimuli. So a perfect example of that is even touching the area lightly can cause pain, or even putting on clothes where the clothes rub up against that area can cause pain. Taking a shower when the water hits that area can cause pain. This is obviously very troublesome, and the treatment involves giving certain medications. One of the most helpful medications is an antidepressant, interestingly, known as amitriptyline. And then another medication that's used with benefit is gabapentin. So those two medications have been used to treat postherpetic neuralgia. Now let's take a look at some clinical vignettes. 55-year-old man complains of stinging pain for 3 days in the facial area involving the right forehead, from beneath the scalp anteriorly, and as low as the level of the right eye, seemingly out of proportion to a red rash he notes that is appearing today. The area of erythema involves a band that matches the area of pain reported by the patient. Exam reveals a 1 to 3 millimeter vesicles on the right cheek against an erythematous background. Which of the following is most likely diagnosis? Well, they describe the pain as stinging, they characterize it as a band, and they talk about vesicles on a red base. That's all characteristic of herpes zoster, which is also known as shingles. Next question. 71-year-old man with osteoarthritis comes to the office complaining of a painful band-like rash across his left chest. He denies ever having a similar rash before, plays golf 3 times per week, takes only NSAIDs for pain from his arthritis. Temperature is 98. On his left chest, in the T5 dermatomal distribution, is a macular-papular erythematous rash that is painful to touch. There's a mild weeping of some of the papules. Most appropriate therapy is. Well, the fact that they mentioned dermatome really gives it away. And of course, we're talking about shingles, herpes zoster, and the treatment involves antivirals. So the antiviral in this question, right here, again, ganciclovir. And then finally, 66-year-old woman comes to the clinic complaining of severe pain across her chest and abdomen. You treated the patient for shingles 5 months ago, and at that time, she had a shingles band at the T8 level. The current pain is in the same region where she had her shingles. She states that she cannot stand to have her clothes touch the area, and even shower water hurts. She has hypertension and glaucoma, for which she takes beta blocker and lisinopril. At the level of her T8 dermatome on the right, she has marked allodynia, primary and secondary hyperalgesia. The area is exceptionally tender to palpation, and most appropriate therapy is. Okay, well, this is an excellent question. She had shingles 5 months ago, and now she has post-herpetic neuralgia. And they talk about the allodynia. Allodynia, of course, is just a situation where even non-painful stimuli are causing pain. So that's described here with this clothes touching the area and the shower water also touching the area. And then they also describe something called hyperalgesia. What that means is that surrounding tissues also have pain as well. So the treatment for postherpetic neuralgia basically involves certain medications, and one of them is an antidepressant known as amitriptyline, and another one that's commonly used is gabapentin. And in this question, they have amitriptyline. Lidocaine cream is sometimes used, but its benefits are very minimal, so that's why it's not the most appropriate therapy at this time.